What is a physiatrist? Modern medical specialty began to develop during World War I. Coalesced during and after World War II, and the polio epidemic. Addressing need for rehabilitation of injured veterans and polio survivors. Physiatry formally recognized as medical specialty in 1947. Today, over 11,000 board-certified physiatrists nationwide. Physiatry, myths and truths. Physiatrists are MDs and DOs able to diagnose and prescribe, located throughout the U.S., available for inpatient and outpatient care. Integral members of the care team. Physiatrists are not in competition with PCPs, physical therapists, physiotherapists, chiropractors, psychiatrists. Physiatry, training, 4-year medical school. Residency programs. 78 accredited programs listed in the U.S. in 2015. 1-year internal medicine prelim, surgical prelim, or transitional year. 3 years PM&R training. Fellowships. Fellowship programs allow for subspecialization. For example, spinal cord injury, sports medicine, pain. Subspecialty fellowships accredited by the IGM for physical medicine and rehabilitation include hospice and palliative medicine, neuromuscular medicine, pain medicine, pediatric rehabilitation, spinal cord injury medicine, sports medicine, traumatic brain injury. Subspecialty/fellowship training. Non-IGM accredited fellowships available for physical medicine and rehabilitation include cancer rehabilitation, multiple sclerosis, neurorehabilitation, research, spine rehabilitation/interventional spine. The physiatric approach. Guiding principles. Patient function and quality of life. Integrated care. Combined pharmacological and non-pharmacological modalities. Non-surgical approach to treatment and rehabilitation. Coordinate interdisciplinary treatment team. Work with PCP, specialists, physical and other therapists. Multi-specialty approach. Residency training is unique in its multi-specialty process, which allows for a very unique patient care approach. Physiatrists receive formal orthopedic, rheumatologic, musculoskeletal and neurologic training to care for patients in both inpatient and outpatient settings. Physiatrists perform electromyography, musculoskeletal ultrasound and advanced spinal/joint injections. Priority is to avoid surgery while maintaining function. Physiatry, improving function. Goal is prevention, diagnosis, and treatment of disorders that may produce temporary or permanent impairment. Restoration of function. Maximize quality of life. Holistic approach, the whole patient, not just a body part. Patient-centered care. Practice settings, inpatient. Leads an interdisciplinary team, physical, occupational and/or speech therapist, social worker, psychologist and chaplain, oversees the medical component as well as prescription of therapeutic modalities. Typically treats spinal cord injury, brain injury, traumatic and non-traumatic, stroke, multiple sclerosis, polio, burn care, and musculoskeletal and pediatric rehabilitation. Practice settings, outpatient. Experts at non-surgical management of conditions including orthopedic injuries, spine-related pain and dysfunction, occupational injuries and overuse symptoms, neurogenic bowel/bladder, pressure sore management, spasticity management and chronic pain. Typically practice in multidisciplinary groups with other physiatrists, orthopedic surgeons and/or neurosurgeons. Physiatry, conditions treated, musculoskeletal, trauma and injuries. Sports or work-related injuries, repetitive use disorders, for example, carpal tunnel syndrome, acute and chronic pain syndromes, back/neck pain, diseases, osteoporosis, arthritis, other, rehabilitation following joint reconstruction, amputation. Physiatry, conditions treated, cardiovascular, cardiac rehabilitation, vascular diseases, pulmonary, COPD, other respiratory dysfunction. Others include rehabilitation for cancer, HIV, pediatrics, geriatrics. Physiatry, conditions treated, neurologic, spinal cord injury, traumatic brain injury, stroke, multiple sclerosis, peripheral neuropathy, movement disorders, Parkinson's disease, cervical dystonia, and other focal dystonias. Motor neuron disease. The physiatric approach to care. Examples: traumatic brain injury, improve cognitive and social functioning and return to work issues. Acute disc herniation, maximize function and decrease pain with various injection techniques, including epidurals, and physical therapy, while avoiding surgical intervention. Post-hip replacement, decrease pain and improve functional gait/activities. Sprained ankle, strengthen and improve proprioception. The physiatric approach to care. Examples: post-knee, optimize cardiopulmonary function. Spinal cord injury, manage spasticity and assess need for appropriate adaptive equipment. Post-stroke, increase mobility and range of motion in patients with spasticity, use focal treatment with botulinum toxin or phenol injection in conjunction with physical/occupational therapy.